Talking a lot about mosquitoes as we've been reporting. Spraying begins this week to kill them in 13 local communities now at high risk for Triple E. Here with advice, Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General Hospital. Dr. Raja, thanks for being here.
Hey, Dr. Raja, it's great to see you. So 2 weeks ago, a man in his 80s from Oxford was diagnosed with the virus, but until then, it had been 4 years since Massachusetts had actually seen a human case. So why is the state worrying so much about a disease that is honestly, to use a word, rare?
Yeah, I'm glad you mentioned that, Ed, because Eastern equine encephalitis, or Triple E, is exceptionally rare. It turns out there's only been about 120 cases total since the virus was first identified here in Mass in 1938. But like you said, we had this last outbreak back in 2019, and during that outbreak, there were 17 cases and 7 deaths. So it can be really severe and needs to be taken seriously. So since the best way to prevent Triple E is to prevent mosquito bites, the state is conducting both aerial and truck spraying of parts of Plymouth and Worcester counties with pesticide to decrease the risk of spreading.
Right. Yeah, exactly. So you mentioned Plymouth, one of those high-risk towns. Officials have decided Friday, they decided to close all public parks and fields from dusk to dawn. So do you think that's the right call, given what you just said, just try to avoid them altogether?
I do, Erica. You know, I bet that was a tough call given what an amazing weekend it was in terms of weather, but it was absolutely the right strategy. You know, we all need to be thinking about how to avoid getting bitten by mosquitoes right now, whether that's getting rid of standing water around your house or fixing window screens on your windows or wearing long pants and sleeves and mosquito repellent whenever we go out.
So, Dr. Raja, you know, fever is a common symptom for a lot of infections, right? Not just Triple E, but of course, no one wants to ignore the first signs of something serious. So what is your advice about getting checked out?
Well, Ed, you're right. You know, we don't want to ignore it, but we have to remember just how rare Triple E is. So if you do get a fever or stiff neck or a headache about 3 to 10 days after a mosquito bite, call your primary care right away. They're going to evaluate you and decide if you need further testing, which can involve blood or even spinal fluid tests. So fortunately, the vast majority of people who have symptoms won't have Triple E. But like you said, you definitely want to be evaluated if you do develop it.
Knowledge is key, Doctor.
Yes. Thank you, Dr. Raja, as always.
Thank you, Dr. Raja.